مرحبا گلک خوشحالم لگل هوالان روش باش و دم باش. We continue the medical terminology, medical language. So the terms, the words that we use in medical, so it's very important to be international. Everybody in the world, in Europe, in Rojava, in everywhere, say that they must we have a universal language. When you read the English book of medicine, so you must know the terms. So it's very important because every in this field, so it's better to have the universal, it's a international terms that we use. So all these terms about most of the terms of the medical terminology, medical language comes from Greek or from Yunanistan. So most of the words. So originally all these are from there, and they so develop under history. So we talk about the ischemia. Ischemia was the condition or the situation that is the shortage of oxygen. When oxygen is cambo, so we have no enough oxygen to use for metastasis, for the metabolism of to use the energy for the cells. So when we have not enough oxygen, so the phenomenon that appear is the we lose the color of our skin. For example, so it causes the cyanosis. Cyanosis is the bluish or purplish or discoloration. We lose the color of the normal color of our skin, for example. So here in our fingers, so it comes to be bluish when there is shortage or lack of the oxygen. So it means that something happened. So oxygen is very important for the tissue. For tissue, oxygen is very important for tissue. So the skin or mucous membrane, so coming to be cyanose, means bluish, blue color. So the phenomenon that caused this is the lack of oxygen. So ischemia. So when there is a little oxygen, not enough oxygen cambo, hypoxia. Hypoxia is the condition when the body or the region of the tissue, so not enough oxygen. So maybe generalized, all of our body have not enough oxygen, or maybe, for example, a local means منطقه کم. Generalized means all of our body. So it is important to recognize that the patient needs oxygen, to have the mask of oxygen for lungs, to have enough oxygen to send to the body. So it is important. That's the cyanosis. When we talk about the patient is cyanized, or for example ischemia or or hypoxia. So we talk about the mucous membrane. Mucosa is the mucous membrane, or mucosa is a membrane. Membrane means غشا, means around of something, so it's a membrane. Membrane of living or creatures. For example, a cell have a membrane, cell membrane. Jelde cell, for example. Jelde bacteria, membrane. The surface of the, for example, if this is an amoeba, a unicellular, for example, a bacteria, around this is membrane around the cell. So epithelial cells of the, for example, here in my skin, so over this, the cells, the first layer of cell are epithelial cell. So it's important, epithelial cell. In bronchial mucosa, we have bronchial mucosa, bronchia. Here, from the lung, that it is from here, is a bronchia. Or endometrium in uterus, in women, girls, they have endometrium, or esophagus mucosa. Esophagus, yeah. When we eat food, so go to esophagus, to mede, to the stomach. Or gastric mucosa. So, in another term of the terminology of the medicine is very important for you to know is pathology. Pathology, everything that's come from, for example, here, pathology. It means is the study of, logy means to know, study, know about something. Logy, pathology, biology, microbiology, virology, everything that's gynecology, for example, pharmacology, molecular biology. Logy means to know about, to study something. The patient, for example, patho means the disease, the injury, something that study of the cause of the disease is pathology. For example, we send the patient biopsy for pathologist. Pathologist is the doctor or a specialist that study the disease, what cause of the disease, the pathology. This is a pathologist that find by biopsy or autopsy, find the cause of the disease. For example, it's the cause of the of poison, toxin, bacteria, or something like that. So it's very important to know about pathology, the terms of pathology. So pathologist is a person that study the cause of the disease, pathology. So we have for example, a term that named HCM. HCM in the medical field means hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy. So this is a disease of the heart. Del. Thickened Thickened means zakhim. Zakhamat tissue of the heart is called HCM. So, for example, here, this is a heart, qalb, del. This tissue here is thickened. For example, if you compare with this side, this is normal, but here is thick, enlargement, yani gawrabu, here, yani umazana or buchuka, kama. This hypertrophic of the hypertrophy means changing of the cardia. Cardia means del. Mayo means azole, tissue. Pathy means to have some disease. I told you pathology, for example. So this is a disease of, we don't know, maybe Morus Ers, maybe genetic. For example, if mother or father have this, so phenomenon, this disease can give to the new generation or cannot give. Maybe enlargement means to be gaura. So the heart muscle means tissue, azole. So this is hypertrophic cardiomyopathy. So antibiotic. What is antibiotic? Anti means Z, anti, anti-terror, anti-terrorist, for example, everything that's come, the anti is a prefix of the words. Everything that have anti begins with anti, so it means the against. Bio means a living organism. For example, antibiotic is type of antimicrobial substance active against bacteria. So antibiotic gives to bacteria, not to virus. So from the before Pasteur, so or Fleming, Dr. Fleming could discover the antibiotic from the most of the antibiotic. Now we are produced by in factory, synthetic, but they are from the fungi, from futur. For example, penicillium is a futur, gives penicillin, is an antibiotic. So when we have an infection, for example, infection that's a cause from the bacteria, fungi, parasite. So this we treat it. We باش بو که به antibiotic باشه که نخوشی و عفونت التهاب بکتری. Therapy. What is therapy? Means treatment. Means باشبونی نخوشی. Therapy. A doctor is a therapist. Medical treatment is therapy. Medical treatment, therapy. For example, physiotherapy, or for example, shock therapy, or therapy means treatment. That the abbreviated or the shortage of the medical treatment, TX or TX like this, is that we try to give the medicine or darman to the patient to be cured. For example, when we have a health problem. So, but we must have diagnosis. It's very important. Diagnosis means to understand, to find. Diagnosis means to understand, to find the cause of the disease. یعنی سبب ناخوشی را چی بکیم؟ آشکار بکیم. او diagnose. As a rule, each therapy has indication and contraindications. So after that we are going to continue this and define this, talk about these terms. But very, very important to give the medicine, right antibiotic to the patient after diagnosis, not before diagnosis. Unfortunately, in Rojava and in Iran, in Iraq, in Syria, in Turkey, in not European countries, so they give the medicine, they give the doctor, some doctors, or they give without diagnosis the disease, different kind of antibiotic and different medicine. So it's not good. It causes resistance of the bacteria. It causes some side effect. I talk about this. What we mean by side effect? What we mean by drug resistance? These terms are very, very important to know about it. So without diagnosis, is forbidden, mamnu, to give darman. We have a phenomenon that named MRSA. MRSA. It's very important, this phenomenon. MRSA. The MRSA is abbreviation of methicillin resistant Staphylococcus aureus. Methicillin resistant, resistance, Staphylococcus Staphylococcus aureus A. So what we mean by methicillin? Methicillin is a very, very strong, strong antibiotic that can kill most of the bacteria, gram-positive bacteria. Gram-positive, so we can come after this to the gram-positive. So, because the doctors used very, very antibiotic, methicillin, for example, penicillin, everything that so antibiotic against this bacteria. This bacteria is found everywhere. This can cause very bad infection. So we can have in our nose. So this Staphylococcus is maybe resistant، یعنی حساس نبود، مقاوم، یعنی برخوردانی که against antibiotic. So this cause we cannot, if there is a wound, so by this kind of Staphylococcus MRSA, so we cannot cure. So the patient may die of this kind of Staphylococcus. So we had in Rojava, I found some Staphylococcus in laboratory, MRSA, very dangerous. Be careful of this Staphylococcus aureus. So in microbiology, I hope to talk more about this. So Geram is the name of it from Denmark. Doctor, for about 200 years ago, could stain or rank, color, to color the bacteria to see under microscope. Some bacteria take a blue color, so it calls gram-positive. Some bacteria cannot have the blue color. They may have a color of like this. سور رنگ سور. So it's gram-negative under microscope. So this Staphylococcus aureus can develop to resistant bacteria. So it's very difficult to kill this bacteria. So maybe, million $1 So in Europe, in a hospital, they used to stop this kind of resistance. So because we have given a lot of antibiotic to the patient. It is a cocci bacteria under electron microscopy. So these 1 cell, 2 double, 3, 4. So, but cocci means like this, round, like a ball. So this GERD, cocci. Cocci means but staph means together, something like together. So Staphylococcus aureus. So it causes infection in the body. So when some antibiotics are useful for a lot of bacteria. So it's broad spectrum antibiotic. Broad spectrum antibiotic means the antibiotic that's is broad, is a lot of bacteria, gram-negative, gram-positive bacteria. So we can use for these bacteria, but it is not, without diagnosis, it's forbidden to give the antibiotic. So broad spectrum means a lot of bacteria can be cured of this kind of, for example, this antibiotic. So this is test in laboratory that we did in Rojava, antibiotic test. So when here is a bacteria, colonies of bacteria on a plate. This is a plate. So this is gel, and we put a little food for bacteria, and bacteria is for example, here like this, with a swab, we put on this plate, and here is a kind of, this can be ampicillin, for example. This a little paper that has antibiotic, ampicillin, furatinin, for example, penicillin, and so on. So this is 7 different antibiotics put on this plate. So here again we have 7 the same antibiotics. So you see here there is no colony of bacteria. Inhibited, killed. Inhibit means stopped the growth of bacteria. Here this antibiotic is not good because couldn't work like this. This antibiotic is not good. This is not good. This is not good for doctor. For patient. Doctor must wait for the 2 days later to receive the answer from makhbar, from bacteriology, that say to the doctor, please give this antibiotic, this is good, these 2 are good, not these, scammer. Here we have, for example, here is a very good antibiotic. Here is a good antibiotic. Here is good antibiotic. So it's a antibiotic test to see the bacteria is resistant or sensitive, حساس. If it's resistant, antimicrobial or antibiotic resistant, so this is resistant, this bacteria is resistant against this medicine. So doctor must know which medicine is good, like this, or here, which is not good, like this. But unfortunately, there are many of doctors give the prescribe or give the to patient medicines without testing, without antibiotic test to find the best antibiotic. So very important to antibiotic resistant test. So if bacteria is resistant, so we must stop to give we cannot give these antibiotics, these 3, 4, but these are maybe good. But this is very important to know about the antimicrobial resistant test, AMR or AR, antibiotic resistant or antimicrobial resistant test. So this is another, so sensitivity. If bacteria is sensitive, so stop by this. So if you, it's very difficult to read. So here we have 3, 6, 9, 10, 11, 12 different antibiotics. 12 different antibiotics to find the best. This is not good. This is not good. This is not good. These are not good. For this is good. This is good because there is no bacteria here. Growth. Here a bacteria. So, sorry. Antibiotic sensitivity means antibiotic resistant test, the same. So, to find the susceptibility means to bacteria is sensitive, hassas against this, the antibiotic or not. So, doctor must wait to find the bacteria, then to find the antibiotic, to find the sensitivity and resistance. This is a little about bacteriology also. So we next time we talk about the other terminology of the medical technology terminology, and have a nice time. I hope to see you in Kobani soon after this coronavirus pandemic. Take care and hope to see you soon.